Welcome back to the deep dive. Today, we are taking on a topic that, we've seen pop up in the research you sent us again and again. It's this huge health crisis that's often called a silent epidemic.
Fatty liver disease.
Exactly. Or FLD. Our mission today is to just cut through the noise and give you a quick, really thorough understanding of what's happening because it is so subtle, right? It's often completely asymptomatic for years.
For years.
And it just doesn't get the attention it deserves until, well, it's often too late. So we're pulling out the key nuggets on early signs, the stages, and crucially, the surprising evidence on natural reversal.
And it's so vital we dive into this because the scale of the issue is, it's massive and it's growing.
Exponentially.
Yeah, exponentially. We're seeing cases linked directly to the rise in obesity, sedentary lifestyles, and just a massive consumption of, refined carbs. Because those early symptoms are so mild, early detection as well, it's frequently missed. But for you listening today, understanding that early window is really the difference between a simple fix and serious irreversible damage.
Okay, let's unpack this. To really get the danger of fat buildup, we first have to appreciate the sheer complexity of the organ we're talking about. Let's start with the liver itself. What exactly is this, 1.5 kilogram powerhouse doing every day?
I mean, it's really the closest thing the body has to an integrated metabolic command center.
A command center and a factory.
And a factory, exactly. It's performing well over 500 essential tasks every single day. We're talking everything from regulating blood sugar to detoxifying chemicals.
Everything.
If the liver fails, the whole system just shuts down. Survival without it is, well, it's impossible.
That 500 number is always staggering. Let's focus on a few functions that really tie into the symptoms we'll see later on. First up, bile. It sounds kind of simple, but its role in digestion is profound.
Oh, it's the first step in processing everything we eat. Bile is what the liver produces to emulsify to break down dietary fats.
So it makes them manageable.
Right, into smaller droplets. If that process is inefficient, you don't just struggle with fat digestion, you actually fail to absorb essential fat-soluble vitamins.
Like A, D, E, and K.
Exactly. So a healthy liver is literally required to pull nutrients from your food.
And it's not just digestive.
Yeah.
When we look at the later stages of the disease, the swelling, the bruising, that ties directly back to its role as a factory, right? Synthesizing proteins.
Absolutely. The liver is constantly producing essential proteins. A key one is albumin, which is what maintains the fluid balance in your bloodstream.
Oh, okay.
When the liver function drops, so does albumin production and fluid leaks out. That's what causes the swelling in the legs or abdomen.
And the clotting factors.
Same thing. When the factory floor gets clogged with fat, as one source put it, the production of those clotting factors just slows way down. And that's precisely why easy bruising is one of the most visible late-stage signs.
So it's managing our construction, our repair, and it's also our metabolic regulator.
It is. It's storing and releasing glucose to maintain balance.
And on top of all that, it's the body's crucial gatekeeper.
That gatekeeper function, you just can't overstate it. Every drop of blood from your digestive system passes through the liver first. It neutralizes chemicals, filters out pathogens, detoxifies drugs, alcohol, everything.
So a healthy liver is just foundational for a strong immune system.
And for preventing system-wide inflammation.
Given all of that, the idea of fat just accumulating in this command center is extremely alarming. So let's define the disease. Fatty liver disease is when that excess fat builds up inside the liver cells. The sources say it's a real concern when fat makes up more than, 5 to 10% of the liver's total weight.
And we have to distinguish between the two primary causes here.
Right.
First, you have non-alcoholic fatty liver disease, NAFLD. That's the far more common type globally.
Right.
It's strongly linked to metabolic syndrome, obesity, insulin resistance, high triglycerides, that kind of thing.
Which is why we're seeing it rise so quickly alongside type 2 diabetes.
Exactly. The other type is alcoholic fatty liver disease, and that's caused by, chronic excessive alcohol consumption. It just poisons the liver cells.
But no matter the trigger, the progression seems to follow 4 pretty distinct stages.
It does.
And here's where it gets really interesting, because that initial stage is entirely reversible. That's a huge opportunity for you listening.
Stage 1 is simple fatty liver, or steatosis. This is just fat accumulation. That's it. It's often completely silent, no real cell damage yet. It's purely a warning sign.
Metabolic warning sign.
Precisely. If you catch it here, intervention is quick and almost always successful.
But if that dysfunction is ignored, we hit stage 2, non-alcoholic steatohepatitis, or NASH. I think we need a clearer distinction here. What's the real difference between just steatosis and steatohepatitis?
Okay, so steatosis is like having too much stock piled up in the factory warehouse. NASH is when that stockpile becomes toxic and, catches fire.
So inflammation.
Inflammation. In the NASH, the fat buildup has started to trigger significant inflammation, and that inflammation is actively damaging and killing healthy liver cells.
And that's when you might start to feel something.
Maybe. This is where subtle symptoms like persistent fatigue or maybe some mild upper abdominal discomfort might start to appear.
And if the body keeps trying to repair this ongoing damage, we move to stage 3, which is fibrosis.
Correct. The repeated cycles of inflammation and repair, they lead to scar tissue being laid down. These fibrous bands start to mess with the liver's structure, hindering blood flow and filtration.
But it's still manageable at this point.
It's serious, but the sources are clear. It's often still manageable, sometimes even partially reversible, with really aggressive intervention.
And finally, the stage we really want to help everyone avoid. Stage 4, cirrhosis.
That is the advanced and, for the most part, irreversible stage. The scar tissue has completely replaced healthy liver tissue, disrupting all those 500 functions we talked about.
And this leads to those life-threatening complications.
Yeah, because the liver can't filter blood effectively. Pressure backs up into the portal vein, which can cause internal bleeding. It leads to severe fluid buildup of sites and, critically, failure of the detox system.
Which brings us right to the symptom.
It does.
So recognizing those early signals is just incredibly high stakes. Let's detail the top alarming symptoms. What should you be watching for first?
Without a doubt, the most common early symptom is a persistent, unexplained fatigue and weakness.
Just feeling tired all the time.
But a different kind of tired. Your liver is the engine of your metabolism. When its function is impaired, energy conversion just suffers, resulting in this bone-deep tiredness that rest doesn't fix.
And if the fat buildup is physically causing the organ to swell, that would lead to actual pain.
Exactly. Abdominal discomfort is next. People describe it as a dull ache, maybe some pressure, or a fullness in the upper right side of the abdomen. That's the enlarged, inflamed liver, what's called hepatomegaly.
It's amazing that it can get that damaged without showing physical signs and often only reveals itself on a blood test first.
That's the silent inflammation. Elevated liver enzymes, ALT and AST, they frequently show up on blood panels long before you feel any pain. And of course, the big metabolic connection, insulin resistance, and type 2 diabetes.
Major warning signs.
Huge warning signs, because the processes that cause high blood sugar are often the exact same ones depositing fat in the liver.
Now, if those early signs are missed and the disease gets to advanced stages like cirrhosis, the symptoms become a crisis.
They do.
The most visible one being jaundice.
Right, the yellowing of the skin and eyes. That's caused by the liver failing to process bilirubin, a waste product. It just builds up in the body. Then we see those catastrophic failures of fluid regulation.
Swollen legs and abdomen, edema and ascites.
Which is when that lack of albumin production we discussed earlier becomes really obvious.
And linking back to the protein factory idea, the lack of clotting factors leads to
easy bruising or bleeding. The liver just isn't making what the body needs to stop bleeding. But maybe the most alarming symptom, because it affects your mind, is the result of detoxification failure.
Right, the neurological changes. Why do toxins suddenly affect the brain?
That's the essence of the mental confusion or difficulty concentrating. The gatekeeper function fails completely. Toxins, especially ammonia from protein digestion, they bypass the liver and travel straight to the brain,
causing memory issues, mood changes,
and in severe cases, something called hepatic encephalopathy.
And a quick note, the sources did mention that for women, fatty liver symptoms can often overlap with hormonal issues, more bloating, irregular periods, especially for those with PCOS.
So we've laid out the severity and the signs. Now, what does this all mean for you if you're worried about these symptoms?
This is where the story pivots.
It really does.
Yeah.
Because the sources pivot dramatically to hope. Fatty liver disease, especially in its early and moderate stages, is one of the few serious chronic conditions that can be fully reversed.
With lifestyle changes. And the clinical evidence we found is just, it's almost unbelievable in its speed. I want to highlight the case of the 21-year-old man with grade 3 NASH,
which is already an advanced damaging form.
Exactly. His plan was comprehensive. Plant-based diet, intermittent fasting, HIIT workouts, plus supplements like milk thistle and vitamin E.
And the outcome just shows the incredible capacity of the liver to repair itself. He lost 15 kilograms in just 45 days. And his fibrosis, the actual scarring, improved significantly within 2 months.
It shows that when the intervention is aggressive, the response is immediate.
Absolutely.
But the study that really hammers home the speed was the surgical donor study. This was 15 people with confirmed fatty liver. They followed a strict 1,200 kilocalorie diet and exercised for 60 minutes a day.
And here's the kicker. After only 28 days, less than 1 month, 14 of the 15 showed major reduction in liver fat.
And 7 of them.
7 achieved complete normalization of their liver tissue. This is clinical proof that you can radically change your liver's composition in a matter of weeks.
That intensive regimen basically forced their bodies to use the stored fat in the liver for fuel. It was like a targeted fat-burning program for the liver itself.
Exactly. But this raises a critical point for you to think about. That 28-day study represents speed. But it's an extreme effort. It's not sustainable for most people. What about sustainability?
That's where the long-term study of Japanese adults comes in. It shows the power of consistency over intensity.
A different approach.
Totally. They found that exercising just once per week, but consistently, still resulted in a 46% remission rate of NAFLD over 10 years.
That contrast is a huge takeaway. You can go for speed and intensity, or you can go for consistency and sustainability. Both paths can lead to reversal.
Consistency matters. Every single session contributes.
Every single one.
That is so motivating. Okay, let's wrap up by giving you the practical, actionable advice for natural reversal. The sources are unanimous. Diet is number one.
Absolutely. The foundational goal is a liver-friendly diet that drastically limits sugar and refined carbs. When you eat excess glucose or fructose, the liver converts that energy into fat.
The novolipogenesis.
You got it. You have to stop spiking your insulin.
So cut the refined stuff, but what should we be adding in?
Boost your fiber and antioxidants. High-fiber foods like oats and legumes, they slow sugar absorption. Antioxidant-rich foods, leafy greens, berries, help counteract the oxidative stress and inflammation of NASH.
And we shouldn't fear healthy fats.
No, not at all. Healthy fats from olive oil, avocados, nuts, omega-3s, they're beneficial. They help stabilize blood sugar, which ultimately helps reduce liver fat.
And moving beyond the plate, physical activity is non-negotiable.
30 minutes of aerobic exercise, even just a brisk walk, 3 to 5 times a week helps directly burn that stored liver fat. And don't forget resistance training. Building muscle boosts your overall metabolic rate.
So you burn more fat even at rest.
Exactly.
And the simple math of weight management is a massive lever here.
It is. The sources show that just a 5 to 10% weight loss can significantly reduce fat buildup and, critically, reduce the inflammation of NASH.
And of course, hydration and limiting alcohol.
Crucial. Adequate water supports detox pathways, and if alcohol was a factor at all, complete elimination is the only way to recover.
Finally, what about specific supplements? What did the sources keep mentioning?
They often cited milk thistle, which contains silymarin, known for supporting detox and reducing inflammation. Also curcumin, or turmeric, for its broad anti-inflammatory benefits.
And the one that always surprises people? Coffee.
Yeah, moderate coffee intake is repeatedly associated in studies with reduced liver fat, lower inflammation, and improved liver enzymes.
So, to summarize our deep dive, the liver is this incredibly resilient, vital organ. And while its distress signals are often subtle, that persistent fatigue, that dull upper right pain, the potential for reversal is just enormous. The sources are definitive. Lifestyle changes are the most effective intervention there is.
So if you recognize that fatigue, that mild pain, or if you have those metabolic issues like diabetes, consult a healthcare provider. Get tested. Early intervention is your greatest leverage.
Agreed. And here's a final provocative thought for you to consider. Given those incredibly quick reversal rates in the aggressive short-term studies, like that 28-day one, how should our understanding of the timeline for reversing chronic metabolic conditions change? Are we often underestimating the body's repair capabilities? And should short, intense reset periods maybe become a core recommendation for chronic disease management? Thank you for joining us for the deep dive. We'll see you next time.